Hello, I am Olivia. I am currently a reablement support worker and studying the Access to Health Science. I am aware that becoming a paramedic is a high demanding and complex job role, experiencing high pressure situations as part of a team, as well as solo in a rapid response vehicle, unfamiliar and unpredictable environments, as well as dealing with patients and members of the public who are experiencing high distress or upset. High level of teamwork is required as a paramedic, working alongside the police force, fire rescue team and coast guards, using complex equipment and a range of medication. I am aware that the job role requires working shift patterns in evenings and on weekends. When researching into the paramedic role, I found that a paramedic's role has significantly evolved over the years and has greatly expanded their range of medical conditions. They previously used to focus on providing emergency care at the scene of an incident or at a sudden medical emergency, but now they are trained to provide support for long-term conditions, acute conditions of mental ill health, social care assessments and urgent care. They've also now have the falls response team for uninjured and minor injuries, providing assessments, advice and exercise regimens, and have also been localised in the clinical centres. They are also being based in emergency departments, supporting with triage patients, providing medical care and stabilising patients before transferring to a hospital. They're also working within the critical care transport, where they are responsible for supporting the medically ill patients when transporting between medical facilities. I've also found that WAST is one of the most clinically advanced ambulance services in the world. The development in the role of a paramedic has led to a wide range of career paths where paramedics can progress in the clinical practice to either a specialist, advanced or a consultant paramedic. There's progression in the leadership and management roles, starting as a team leader, providing immediate leadership at the scene of an accident, as well as day-to-day administration. To then progress as a manager, a senior manager or a director. There's progression within the research and development team, where you begin as a research paramedic and can then further progress onto a research fellow, a reader or a professor. There is progression within the educational roles, starting as a practice educator and then further progressing to a lecturer, a senior lecturer or a professor. I'm also aware of the job roles within the military, the clinical contact centre, the critical care professions such as the heart team or the helicopter emergency services, which is HEMS. All of these roles are regulated by a number of bodies, such as the NHS, who are the public funded National Health Services of Wales. There's HCPC, who maintain and publish a public register of qualified members of a profession. But more specifically, paramedics are regulated by the College of Paramedics, who are the professional bodies for registered paramedics, supporting and educating them, providing them placements where they would be monitored by a specially trained paramedic. These are also in partnership with the subject benchmarks statement. And there is also WAST, which is the Welsh Ambulance Service, which would be the employers of the paramedics. My understanding of the paramedic course, this is a full-time course of 42 weeks with 50% practical within the practical suites or on placements and 50% theory in the teaching facilities, consisting of 14 modules over the 3 years. I am aware that the placements can be up to 6 to 12 weeks anywhere in Wales, and it involves a variety of practical and theory assessments. I am aware that the placements are in place to undertake practice under supervision whilst integrating theory. Swansea University is appealing to me because of its cleanliness, as well as being ranked a gold in the Teaching Excellence Framework, also the 50-50 theory and practical education. I am thoroughly looking forward to the simulation room, which I attended to at the October's opening day. This was very appealing and very exciting to me. So here is my declaration also. I understand as part of the course, I will be sent to clinical placements across the whole of Wales. I am aware a full manual category B licence with a maximum of 3 penalty points, a C1 provisional driving entitlement by the start of the course, and an enhanced disclosure bearing service check is at my expense, and a satisfactory occupational health check.